Thank you for your introduction and thank HIFU Technology convene us here in Chongqing to explore the technology. So the speech of my is clinical application and exploration of FUAS combined with hysteroscopy. So uterine fibroids are the most common benign tumor in the female reproductive system. The different size, location of the fibroids may cause the different symptoms. So according to the different symptoms and the willingness of the patients, we have different ways of treatment. So in the early period of time, many of the women patients have their uterine resect. And nowadays, we have the consensus to preserve the organs. So we have some more minimal and non-invasive treatments to preserve the human being's organs. And this type of treatment is well received and welcomed by the women in ISMINIM, and it can help to ablate the fibroids without sparing the other tissues of the lesion. So I would say 90% of the myoma could be treated by this technology, but as the treatment, it has its indications. Especially, we know that for the submucous myoma or type 1 or type 2 submucous myoma and a myoma diameter less than 5 centimeters, and intramural myoma surface covering muscle layer less than 0.5 centimeters. So there are some of the advantages of the hysteroscopy, but also with some limitations of these surgeries. So in the clinical application, I will focus on part of the level 2 submucosal fibroids or level 3 submucosal fibroids. So it can not only cause the coagulative necrosis of myoma, it was found that some myoma had flow go down type phenomenon. So we're very curious about this phenomenon. In the minimal and non-invasive surgeon, so the hysteroscopy is well received in terms of preserving the organs of the women. But there are also some difficulties and limitations for it. So we have to use some pre-treatment before the operation. And the preoperative pre-treatment of the hysteroscopy. So the most studied drug of this type is GnRHA. And to shorten the operation time is the objective, and to reduce the absorption of the descending fluid and the probability of residual myoma. So we would like to downgrade these myoma. So can we explore a new pre-treatment method for difficult HM? And what's the significance of this research? So the treatment could ablate most of these uterine fibroids, but for those women with fertility required, we hope that to help them to get more time for the pregnancy preparation. And this is the case. 30 years old, married, no pregnancy history. So she hoped to relieve her symptoms, and in the shortest time, she would like to get pregnant. So with the focused ultrasound and the scopy, and the fibroids were located in the posterior wall of the uterine cavity, and 40% of them protruded into the uterine cavity. And there are some risks of the uterine rupture with the traditional way, because it is large and with some risks of complications. So after the ultrasound, focused ultrasound, and cognitive necrosis, and the result of the treatment can be seen from the slide. The treatment was 95 minutes, and the radiation time was 520 seconds, and it is resected, and the uterine cavity go back to the normal situation, and then she successfully got the pregnancy. So, as the pre-treatment principles of this surgeon, we have some important principle. The first one is that FUAS causes cognitive necrosis of myoma and reduces vascular opening and bleeding during operation, and it reduces the risk and complications of hysteroscopy surgery. And second principle is after the HIFU surgery, some fibroids are reduced, and opportunity of hysteroscopy myoma removal is obtained, which expands the indications of hysteroscopy to a certain extent. And in the clinical observation of the multiple uterine myomas type 2 and type 3 myomas close to the endometrium were resected after type descending by hysteroscopy. And after that, re-examination of magnetic MRI showed that the myoma of type 4 and 5, 6 gradually changed into 3 and 5, indicating that the classification of myoma was variable under certain conditions. And FUAS was non-invasive, so patients can remove multiple myomas through the multiple FUAS plus hysteroscope. So this is the research of our center and the recent comparison of general conditions of patients in the two groups. So the operation times and enlargement of the uterine are different. As you may see from this table, after the degrading and the step value decreased, for the smaller fibroids can be removed once and for all. And after the operation, the overall evaluation and relief rate are satisfactory for the patients. And also the complication, so the larger fibroids after the surgeon, in terms of complication, we didn't see any more complication. So probably it has something to do with the congulative necrosis. And there are some more papers on this research. And this is another case, multiple uterine fibroids, the large fibroids. So re-examination 2 months after 2 HIFU surgery. Very safe, and this is the contrast 1 year after the operation. So because the woman is infertility, so she said that any treatment is acceptable except surgery. So this is another case. Huge uterine fibroids, so unmarried and with no pregnancy history. So the pre-operation hysteroscopy found no changes in uterine conditions. So after the communication through HIFU operation, we can use this operation to let the myoma absorb by itself after the operation. Unfortunately, after the operation, the myoma was downgraded. And this is the results of the re-examination 20 days after the operation. And when we use the hysteroscopy to treat these residue, it will be easier for us. And this is the uterine recovery after second surgery. So, focused ultrasound and hysteroscopy should be combined and integrated the right time and to play its role. And that's all for my presentation. Thank you.